And at the time that I found out, it was, HIV was a death sentence, basically.
AIDS was the leading cause of death in 25 to 44-year-olds in the United States of America.
We started an HIV clinic here at San Francisco General Hospital, which is the county hospital of UCSF. It's the hospital for low-income individuals, about 18 months later, in January of 1983.
So, at Ward 86 was probably one of the first clinics of its kind.
Ward 86 is one of the nation's leading free HIV clinics, serving thousands each year. Beyond treatment and prevention, its mission is to break HIV stigma and treat every patient with dignity, compassion, and support. Ward 86 now represents a model of care that is recognized nationwide.
It was the site that developed what we now call patient-centered care, in which people are connected to social services, help for housing, mental health care, group support, because the founders understood that treating the HIV epidemic wasn't just about getting a medicine to a person, but taking a public health approach and building broad support for a community that has historically and even now been really persecuted.
Ward 86 is really a magical place. People there are all there because they want to be there.
The most rewarding part at Ward 86 is how dedicated everyone is. Social workers, nurses, medical assistants, pharmacists, to the population. We love them. I love my patients. I've known them for so long. What we could do is let's go down here. If people had Kaposi sarcoma, like some of those old infections that we would see, we would try to do all the treatment here. Maybe an exam room.
Thank you.
Look like you're so. You should be looking like you're so hardworking, which you are. Look, they're working so hard, and
All right,
look,
B-roll it is.
here's me leaning over and saying, "Really, Mr. Burns?
Mr. Burns.
Mr. Burns."
In 2025, the Trump administration passed the One Big Beautiful Bill Act, introducing major changes to healthcare funding and public assistance programs like Medicaid. Medicaid is a government-funded health insurance program that provides free or low-cost healthcare to Americans.
Yeah, so we're very worried about a lot of things going on in the current administration. The big bill, which is going to cut Medicaid after the midterms, will, the majority, 96% of our patients are on Medicaid. So we're gonna have to go through a lot of hoops to just try to keep them on Medicaid.
Trump has cut foreign and domestic funding to HIV and AIDS programs, including more than $200 million in federal funding, ending the HIV epidemic programs, $67 million for the consortia of HIV/AIDS vaccine development has been eliminated, and $60 million for the Minority HIV/AIDS Fund, and $505 million from the Department of Housing and Urban Development's housing program for people with AIDS.
On top of that, our mayor has demanded we cut another $45 million. It's crazy. It's just impossible.
Federal and city healthcare cuts are threatening HIV services across San Francisco. Advocates warn that when treatment and prevention programs are reduced, more people lose access to care. For many survivors, it feels like the same neglect that allowed the AIDS crisis to spread.
San Francisco's part of the Getting to Zero project, and we're so close. But because of the medications, and because of PrEP, we could get to zero. Why would you stop funding the programs that are getting us to zero new infections? It makes no sense to me. How could you do that? My biggest fear is that we're going to see an HIV epidemic, the likes of which we haven't seen since I was your age. And we won't know it. Because when you cut funding to community programs, to testing, people don't get tested. You're destroying an agency whose sole responsibility was to track things like this. So there's no ability to track it. So it could be going rampant. We wouldn't even know. That's what frightens me. it's back to the days of when Ronald Reagan didn't say the word AIDS for 7 years. You know, 2 years ago, 3 years ago, they found a recording of a congressional session behind closed doors. They were laughing and making jokes about the faggots with AIDS. Congresspeople in DC back in those days. We haven't gone much different than that now, where we're at now. People forget that the Orange Clown, see, I don't say his name. The Orange Clown, when he was first in office, promised to end the HIV epidemic. He just forgot to tell us that it was genocide by neglect, which is how he's going to do it.
I think one of the things that can still get in the way from people accessing care is stigma. And that can be stigma around being HIV positive. There is still a lot of stigma around being gay.
The Trump administration didn't celebrate World AIDS Day or commemorate it on December 1st, 2025. First time that there wasn't a World AIDS Day mention.
I think what it does for me is that anger that I had pushed down for so long. I'm sorry. It's coming back.
It just doesn't go away. You know, I'll end it with this. I'm going to paraphrase, and you should look this up if you haven't seen it already. Larry Kramer, y'all know who Larry Kramer is, I would hope, started ACT UP. He said this in one of these interviews, and it's a great soundbite. He told these people, plague! Fucking plague! 35 million infections worldwide is a plague. Well, guess what? We have 47 million people living with HIV globally. It's still a fucking plague.